Hello, everybody. Hello, everyone. I'm Astrid Gutman. I'm a senior scientist and the chief science officer at ICES. I hope everyone was able to take in Dr. Kieran's impressive keynote. Just as a reminder, all of our sessions are recorded. If you weren't able to catch it, they will be available on our website. So I'm delighted to welcome everyone to the first of two related panels this afternoon. And these panels are meant to really bring us into an exciting new era at ICES. So very recently, Ontario has approved regulation changes that will allow ICES to collect data from a wide variety of agencies and other ministries, which is an exciting development and one that we wanted to spend some time getting others' perspectives on the best way in which we can approach this. So we are certainly not the first jurisdiction to be able to link administrative health data with other types of data, in particular data from other sectors, other ministries. As many of you might know, in the Nordic countries, one is assigned a unique identifier at birth that covers all services offered by government, from health to education to justice, employment, et cetera. And so those countries for a long time have been able to do really interesting and important research with those data. But there are other jurisdictions closer to home. So Manitoba has been able to do these kinds of linkages and is really, the leader in Canada for impactful work. But many other jurisdictions in the US, there's a lot of work more at the local and municipal level to be linking data across sectors. In England, there's an incredible initiative to be linking all of the health and education records for children. And closer to home, we have had some work that's started to do that in Ontario. And so we're very fortunate to have four esteemed professors on this panel who will each speak to the work that they've done in their respective jurisdictions. They'll each speak for about 5 or 6 minutes, and then we will start to take questions. Just as a reminder, there's a Q&A button, so we will certainly take questions from the audience, and we have a few in case it's quiet in the beginning that we can start with. So everyone's bios are on the program, so I won't go into too much detail, but just to say, and in order of they're speaking, Professor Dennis Culhane, who's the Dana and Andrew Stone Professor of Social Policy at the University of Pennsylvania, will go first. Then Dr. Marcelo Urquia, who's an Associate Professor in the Department of Community Health Sciences at the University of Manitoba and a scientist at the Manitoba Center for Health Policy, and also still a member, faculty member at ICES. Professor Ruth Gilbert, who is Professor of Clinical Epidemiology at University College London and a senior scientist at the Great Ormond Street Institute of Child Health. And then finally, Professor Yona Lunsky, who is an ICS scientist and the director of the Israeli Adult Neurodevelopmental Center at the Center for Addiction and Mental Health, as well as a professor in the Department of Psychiatry at the University of Toronto. So we're really looking forward to hearing from our panelists. And then after this panel, there'll be a brief break. And the second panel will be a panel of policymakers reflecting on the role of these broader data in terms of policymaking. So with that, I will welcome Professor Culhane to join us.
Thank you, Astrid. I really appreciate being invited here, and congratulations to ICES for the new authorities that you have. Astrid, can you hear me?
Oh, yes, I can. So Dennis, do you want to start with your thoughts on the work that you've done?
Sure. So I direct a center called Actionable Intelligence for Social Policy, and we work with state and local governments around the United States, helping them to build the capacity for linking data across education, health, human services, housing, workforce programs, and justice programs, and tax data. And this enables these communities to be able to do longitudinal, multi-sectoral analyses, research that can support decision-making by government across many domains. And really the key to it, to making it happen, is figuring out how to build partnerships across these different groups. These are not necessarily entities, agencies that would ordinarily be regularly collaborating, even though they may be serving the same populations. So we use the governance process, the data governance process, as the means by which we engage that collaboration and build trust among the partners. The governance process is unique in each place, each community. It could be a single committee, but our advice to most places is to have multiple committees. You have one which is for the senior policy people who might meet less frequently just to sort of get updated on what's happening. The data custodians who represent the agencies and can make decisions about which data can be shared for which projects. But then you might have advisory groups of researchers, citizen groups, and advocacy groups who are working on behalf of children and underrepresented people. There might be a data managers group, of course, that handles all the details about data transactions. So all of those relationships get embedded in what we call the data governance process. In terms of the kind of projects that are most common, I would say that the key foci have tended to group around two categories. I would call them developmental transitions and special populations. Developmental transitions would include things like early childhood development and school readiness. It might include the transitions to adulthood following people as they leave high school and go into occupations, training, or higher education. Looking at workforce outcomes as a trajectory for some of these populations. And then eventually, of course, like things like retirement and aging and how people are in and out of the labor force for various reasons. In terms of the special populations, we would include in this people who might experience homelessness, people who are incarcerated or have been incarcerated, people with certain disabilities, youth who might be in foster care and maybe aging out of foster care, military veterans, things like that. So there are some populations that we also see a lot of focus on where there are particular concerns from a policy or a collaboration perspective among the different agencies. So that's essentially what we're up to. We now have in our network about 35 states that have developed this sort of integrated data system or data linkage capacity, and another 15 or so large counties or municipalities that also are doing this. I would just note, by the way, that our federal government, our Congress has recently authorized some investigation at a federal level about how data could be linked and shared for analysis, research, planning purposes, evaluation at a federal level, but that is just getting underway.
Thanks very much, Dennis. Those are very interesting perspectives on the governance. I'm just curious before we move to Marcelo, what would the advice be as we start this almost from scratch in terms of, from your experience, where we might start in terms of either areas or partnerships based on how you've seen the work unfold in Pennsylvania?
Well, I think that you probably have some agencies that are very kindred to health. They're not necessarily already in your data holdings around health, but which are closely aligned. And for example, education in schools, or even looking at some special populations. So I think that there may be some natural alliances that will be easy to sort of engage and get involved in the process. Because I think you also have to keep in mind that this is going to be a multiple way street. People are not just going to be interested in being able to support the work you're doing around health. They're going to be very interested around how health data can inform their understanding of what's happening in their population. So part of it is developing a sort of mutuality, what's in it for everyone kind of approach. And that we have found to be most useful, trying to find out how we can mutually support each other in exploring their data.
And then just on that, and then we'll move to Marcelo. The content and subject matter expertise of scientists, was that something that developed once the areas of focus became more clear from the policymakers, or did it go the other way around, or a bit of both?
It's been a bit of both, because a good number of our sites, I would say probably a quarter of our sites, are based in universities. So you already have domain experts who have come together and are maintaining this integrated data system, partly in support of their research, although most of their research usually is commissioned by government as well. They're doing it on behalf of a state government. But we also find that a lot of communities don't have researchers. They don't necessarily have relationships with researchers. So part of what we do is we help to connect the research community with some of the data owners who are looking for people who can inform their process and the questions and the work that they're doing. And one really convenient way that happens is we do projects, we call them multi-site projects. So we might have 4 or 5 communities together collaborating, and we bring in expertise that can inform, across all of those communities.
Thank you, Dennis. That's very, very helpful. We'll bring Dr. Urquia, Marcelo, next to sort of give us some advice from his experience at the Manitoba Center for Health Policy.
Thank you very much, Astrid. Yeah, I'm happy to be here. Well, just to give you a brief advice about what I have learned about linking new non-health data, is that it's very important to have content expertise in all the process of linking the data from the first stages. By first stages, I am saying the data sharing agreement, the negotiation, and the parameters of the agreement, right? Well, as an example, I can tell about that we recently at the Manitoba Center for Health Policy, thanks to a CFI grant, an infrastructure grant that focuses on the acquisition of many non-health data sets to improve the social determinants of health in the repository. One of the latest acquisition is the vital statistics data that includes births, marriages, common law unions, and dissolutions. So I have used some of these data at the national level, but not at the provincial level, right? So I knew the data. And during this process, I was involved in reviewing the drafts of the data sharing agreement. One thing was that I realized that were some variables that were missing, and that the year that was starting the data sharing was the year 2000, but I knew that these data sets are started in the 70s, at least with the current data structure, right? So knowing that, we were able to advocate for more years of data for all the data elements, and we finally got it, right? This was an example in which I personally had the expertise, right, and could tell. But we also have justice criminal data sets in the repository, which have not been very much used because there is a lack of content expertise by health researchers, right? So this is a very technical language, and so in order to make them more accessible and research ready, we reached out to some criminal lawyers who helped us connect with some law students, some of which were hired for a few months to help create and develop the metadata documentation, the concept dictionary, what is the meaning of the variables, and some concepts that are in the data set or topics that can be studied with the fields that are in the data sets, right? So during the process, we also learned that one data set, particularly the prosecution data set, should contain a variable that wasn't in our data set, right? And this was a very important variable that was key for doing research on domestic violence, and we had it in another data set. So this person had hands-on experience of entering the data into the system, so this person knew. So based on this tip, we reached out to the contacts in the Ministry of Justice, who confirmed that the variable existed. So then we requested it, and they say, yes, no problem. Yeah, so finally we got it. But otherwise, without these students, we won't be able to even know that this variable existed, right, and could be used, right? So this, it's a good example that without the content expertise or engaging people who have that content expertise, we may be missing many key research data elements.
Thanks, Marcelo. And just to follow up, similar to the question that I asked to Dennis, so you had for instance, the criminal lawyer and the law students who helped you with the data elements. What about the engagement with the sort of scientific, expertise? So people who know a lot about, who research the justice system. Has that been, what's the strategy been for that? Has that happened organically, or were you sort of fairly directed at how to try to engage?
Well, I am not really into. I think this so far is being done on a project basis. I am not really into this into a project that is applied using the justice data. So I cannot provide specific examples, but I know there are other researchers that are the center, who have that experience.
Yeah, no, it's interesting. It's one of the things that we are thinking quite long and hard about how to do that. I'll ask Professor Gilbert Ruth to come on and share some of her advice from her experience in England for how we start on this new journey.
Thank you, Astrid, and thank you so much for inviting me. You know, I'm very excited about the change in legislation in Ontario, and that you'll be able to get education data. So I wanted to say something about the eChild database, which I've been involved with for 10 years, trying to link education, children's social care, and hospital data for the whole of England. And so how did we do it? I mean, we started 10 years ago with some funding and supported by a very persistent funding at Economic and Social Research Council. And we've had access to the full data for England for the last 3 years. So it's been a very long time coming. How did we get back in? How did we get started? Well, as I say, one thing was the funding, really important to keep the permissions and negotiations going. It was very much led by an academic team, but working with government partners. And if you can all look back in your own jurisdictions over the last 10 years, there's been a huge shift in attitudes to the use of administrative data. And we've, been working through that in England. So that was one thing. It was really important to have academic leadership initially, because we had the questions, we could articulate the sort of public benefit case, we could explain the sort of study designs and so on. I think perhaps more easily than our colleagues in government departments could, and we were much more familiar with, ethics and governance permissions than they were. The other thing we could do uniquely was to do that early public engagement and involvement. I mean, 10 years ago, I was going around different children's charities, explaining the vision, getting their support, getting their written support that went into permissions. And that's carried on as we use the data more and more. Then there's a lot more public engagement and involvement for specific projects. And then I think Marcello, I think you touched on it. One of the other things that was really important was I'm at University College London. It's a big university. I come from a group that has done lots of health research, but we also had the Institute of Education with a lot of scientists who'd been working on education data for, since around 2000. And that made a huge difference to our capacity and understanding of the strengths and limitations and what we could do early on. So we're now in a phase where we're opening up the data beyond researchers in UCL, and that's really taken about 3 years of negotiations. And that's been driven very much by government, especially the Department for Education, who are really keen to use this data for their own analyses. Department of Health similarly. So where's the partnership's changing, and that's been really important, really helpful to us. And it means that we're also opening up the data to UK researchers. Sorry, everyone across the pond, it's just UK at the moment, but we're working on that. And one of the great things that our funder has done, called the Administrative Data Research UK, is they've funded, they're on their second wave of fellowship funding now, for 18-month fellowships for people from diverse backgrounds. So we're getting applications from people in education, people in social care, people in health, of course. So it's really pulling in, very good applicants to get experience with the data. Then to keep this going, I think what we've been seeing our role as is to demonstrate that the data is fit for the science and for the policy questions. So we've been doing, quite a large number of exemplar studies. Initially, a big breakthrough. This sounds mundane, but it was to show that the linkage was good. We showed that in recent years, 99% of children in state school linked to a hospital record. So that was really critical to show that we'd be able to see these longitudinal health trajectories and schools trajectories in the same children. The other thing that was important was the longevity, so that we could see across the transitions that Dennis was talking about from birth into school. Did children that we saw with chronic conditions or born very premature then get the special educational needs support that they'd expect to have when they enter school? So big equity questions there. And then, of course, lots of people know that children that have left foster care or been involved in social care services have a much worse time as they enter adulthood. But we are starting to show, 5 to 6 times mortality rates by the time they're 23, much higher rates of preventable deaths. And that's starting to inform policymakers about, who really needs much closer support as they move from adolescence to adulthood. The other thing I wanted to mention as a breakthrough was we're just seeing what good measures we had in school of cognition. So we published a paper early on that showed that week by week of gestation, earlier than 40 weeks gestation at birth, you'd see worse school scores on the attainment tests that were conducted at age 7 and 11. So it was quite clear we had quite sort of granular measures of function that matters to health. So cognitive function, but then similar findings for school absences. Those with more health problems have more absences. Those with more social problems have more absences, and so on. So we could see these functional measures in school that map on quite well to the health problems. And then the other big breakthrough, and maybe we can come back to this because I'm probably running out of time, is that we created a mother-child sibling link in the data, so that we can follow mothers who have been in school or been in social care through to their pregnancies, and follow up the child that's born through to their school readiness test and their trajectory through school and through health records. So that's really sort of centre stage for policy, particularly about young mothers and in vulnerable groups, and then looking at steps through their pathway where there might be opportunities for prevention or mitigation of adverse outcomes. So I'll stop there, and we can cover other things in the discussion.
No, thank you, Ruth. That's really, really important. And I think that intergenerational piece that you talk about that gets enabled and then across the sectors is so important. I wonder, I'm just going to one clarification, the fellowships that you talked about, because I think this whole notion of building capacity to use data, and I think Marcelo, you've reflected on that before around the number of data sets that there are at the Manitoba Center versus the number of core scientists. Were those fellowships for researchers, or were those fellowships for policymakers to become familiar with the research data sets? I just didn't.
Yeah, so the funder funded, they're for researchers, and I think they're all academic. Some of them are actually funded by the Department for Health to have researchers that can work with them. And working directly on policy questions that they've got. So that was quite a nice example to see Department of Health stepping in to co-fund with the ADI UK. You can imagine in our government at the moment, there's major problems with analytic capacity because of cuts to services.
Yeah, and we also, I mean, we think about that a lot, that we bring a lot of analytic capacity to government with our relationships with them, right? So it's sort of a win-win situation, I think. So thanks very much, Ruth. And then lastly, Professor Lunsky. So Yona, you know our environment the best, and have actually done some of the earliest and work with intersectoral data at ICES and over a long course of time. So would love to hear your reflections and advice to us as we start this.
For sure. Thank you. And it's so interesting to hear the stories from different places, because there's so many, I think, consistent themes. But I direct a program that started about actually over 10 years ago. And it began with a project where we wanted to link social services data and health data so that we could better understand health inequities for people with developmental disabilities in our province in adulthood. We knew that things probably weren't as good as they were for other people, but we had just stories, really anecdotal stuff, and data from other countries. So we could have just worked with health data, but the truth is, for this group and other groups, sometimes something like a developmental disability isn't there in the health data. It might be recorded in a school record or somewhere else. And with adults with developmental disabilities, it's often captured in their social services data because they get disability income about their disability. Again, we were lucky we had funding, and funding wanted partnerships in order to get the funding. So this was an earlier CIHR program that looked at partnerships. We spent time even before we got our funding really working on those relationships with government, with agencies that gave services to people with disabilities, with clinicians working in the sector, and with people who worked in social services, and tried to figure out what's the question we all agree on, what's the right data set, how do we do it? So by the time we got our funding, we'd already had relationships going. We knew what some priority issues were. It's, I guess in terms of lessons or things that we got out of it, I came up with kind of 4. The first one is the time lesson. So, it did take us about 2 years to get to that point where we could actually link our data. To tell you that they didn't work perfectly, the linkage. Some people thought that maybe all people with developmental disabilities would be identified in their health data, but about a third of people were only identified in the social services data, and about a third of people were only identified in health data. So we really need to bring things together to do that piece. But that process took a couple of years. That time was also important for the relationships, and it was important to also have time, I think, each time we asked a new question. So whether it was about their primary care, about pregnancy-based care, about use of, what was going on even during the pandemic later, any kind of issue we wanted to look at, we had to unpack and think about, well, what does that mean for this group? And how do we understand it? So it took time to link the data, but it was also time to work on relationships and to build trust. That was another thing that was really important, was having people trust, having folks in policy trust that on the research side, we were going to work together to figure out what things meant and that we would come up with things that made sense. Having people who the data was about have trust for what we were doing, recognizing that it was being done in a fair way, that we were understanding the issues before we decided to, show our findings. So that time and that trust was really important. And also that idea of working with teams, because, you can't just have one relationship with one person who works in, the health sector or the social services sector and policy that understands your issue, because chances are they may transition to another role, and the same as scientists, right? So we had to keep getting our teams bigger as opposed to smaller, and figure out how we work as big teams to do that with trust and with taking time. And then we had to really think about how we translate our findings. So, the research paper that we write is something that only we would understand. One important thing we learned from a senior person in government was that having research snapshots, just putting the name research on the snapshot, the best advice they gave was actually to remove the word research and just call it H-card snapshots, because for people to be able to engage with that material, even if it is research, not everyone wants to know that it's research as they're engaging with it, right? Sort of to pick it up and understand it. But we also had to translate things to people with disabilities and to families, and we had to work with them to do that. And I think the last lesson I learned that probably I got better at later, and again, it was because we had a big team, because we had relationships, was being trauma informed with the data that we're working with. So Ruth, you spoke about, what happens when you look at people who've been in care and what happens to them. Well, if you're going to talk about that, not only do you have to have the relationships beforehand to do it, but you have to think about how can you talk about that in a way? Why do you want to ask that question? What does it mean? And what does it mean to bring that person to the table into the discussion? Right? So we need to think about, if we work in policy or if we do research, we have to know how to work with people who've had trauma happen to them, and think about how we address the questions and how we kind of go further with them.
Thanks, Yona. Those are all really important points, and as you were speaking, got me thinking about, as an institution, how do we support some of that, so that this isn't just individual. You spoke about teams anyway, and needing to have larger teams. You also spoke about relationships with government that can be between researchers and government, but in our case, we also have that as an institution, and we'll need to have that as an institution, just in terms of data sharing, but then also the support to talk about, how do we as an institution support people around that kind of communication and the lessons you learned. And some of it, we've been trying to do in any case, even if our main policy audience would be the Ministry of Health, but then as well, and then your last point around trauma-informed, and again, we've had a whole focus on health equity. We've had a long focus on a new focus on, as we bring race and ethnicity data in, how do we do that in a respectful way? But I think all of those points are really not just, to me, they're geared not just to individuals and individual researchers, but also as an institution. How do we make sure that we support the sort of community of people at ICS who will do this kind of work. So I don't know if you have any additional thoughts on any of that in terms of how an institution tries to help move those things along.
Yeah, I mean, I think you're not just a researcher when you work in an institution. You're working as part of that larger institution, and so I think maybe a gentle way of helping to educate different people about why a certain nuance or a certain thing might be really important, and the strategy for how that works. I think we can get carried away. I think, if my main focus is working with folks in government to figure out something with my data, or just with all the researchers, we can just get sort of insular. And I think we need to think about who are those other people that this might impact, and what experience, even if it's an experience they had 10 years ago with a different group, what does that mean? How does that feel? And to understand that before you enter into conversations, and to help other people understand those things, I think is really important. And things you think you're explaining really clearly, you might realize after that you weren't, but people have to feel safe enough to be able to tell you that, ideally even before it happens, right? But even if something maybe does go wrong, and things always go a little bit wrong, I think having relationships again where you can kind of understand what those things are, to rebuild that trust, or sort of figure out the next piece. I mean, there's sometimes just it might be such a almost benign thing that you don't really think would be upsetting, and you don't understand what the context is because that's not your context. So having those kinds of conversations, I think, and educating everyone is really important.
Thanks. That's very important. I'm going to open it up to the audience. So if people have questions, please use the Q&A button. I don't see any yet, so I will maybe just maybe continue this line of speaking, which is really about, I think in part, about this whole issue around some of the populations that are potentially overrepresented in some of these data, some of the sectors that, again, deal with highly marginalized people. So, you've spoken about that. Ruth, you talked about, when you get into child welfare data. So I'd be curious to hear from each of the panelists, again, about additional strategies for working within sensitive areas, and the kinds of maybe either governance or other approaches that have been important in each of your jurisdictions.
Yeah. Shall I go? Shall I start off then?
Please.
Yeah.
Wonderful.
So it's back to sort of enough funding and time and the, laying the groundwork to be able to do that public involvement and engagement and continually have those conversations. And I think from that, you learn so many things. You learn something about the system. I think Marcello was talking about, needing to understand the data. You also need to understand the system that generates the data and how it's experienced, in this case, by children and young people and by their parents, and those might not be the same. And that then helps to inform the questions you ask, as well as the way you talk about it. And I think it does take quite a lot of time. So we've got a project that we're doing on additional educational needs for children, and relating that to their health problems. We've got a whole work package and a whole team funded to do this qualitative work, which involves lots of surveys, interviews, focus groups, from stakeholders to parents to young people, to try and understand the different perspectives of the service, and in this case the particular experience around interventions for additional educational needs. In the UK, we call that special educational needs, and that's not a word that these young people want to hear at all. And so we try to talk about additional educational needs. But this, I suppose the answer is to have, to see this as a sort of intrinsic part of the work. You're not just doing data analyses. You've got to understand the service, and through that, the questions. I mean, I must say that one other problem that, talking to them has revealed is that it's really hard to understand the intervention. Now, if you come from health, you might have interventions like drugs prescribed, dispensed and taken. That sounded complicated, but it's really simple compared to something like special educational needs provision, which might be recorded in a database, but in fact, from the experience of the young person, might mean months waiting for something, never getting it, but when they thought they'd have one-to-one speech and language therapy, it's in a group of 16. There's these very many details that understanding the perspective of the service user teaches you about the limitations of the data itself.
And Ruth, can I ask, did you do, apart from the qualitative work, but the sort of some of the consultation and understanding, was that in the context of bringing the data in, or was that in the context of specific projects?
So the example I've just referred to, where it's definitely a whole qualitative research package that Cambridge is leading with us, then that's it for a specific research project. But for every bit of work we do, there will be some element of public involvement. It's great that our funder, ADR UK, is also requiring that for the fellowships, that making it clear that public engagement is expected. And it's interesting because I think the health research community is very used to public involvement, engagement, education to some extent, but government analysts not that used to it at all. So we're all learning from each other, and these, the approaches to setting up this sort of engagement is becoming, an area of learning and research in itself.
Yeah, interesting. Does anybody else we do have some questions from the audience, but I wondered if anybody else wanted to weigh in specifically on that area. All right, then I will read the first question, which is, any reflections on missteps that you've experienced that we could potentially avoid from learning from your experience as you began to work more with linked social and health data?
I guess I'll chime in from there. I think that academic-based researchers, so people at universities, have a different view of the world than do people who run a lot of these programs and who are responsible for administering them. They have different motivations oftentimes for the work that gets done, different expectations of what the work product should look like at the end of the day and what purpose it should serve. And so I think that one thing we've learned is that, researchers had to be very sensitive to the context in which the data are collected, how the results will be interpreted and used, and that there has to be a respect for, the whole culture and dynamics in which the public sector has to operate. That we have seen, because you can all, there's a lot of examples of where things blow up because people take for granted that as a researcher, of course, they know everything and they know exactly all the perspectives of these folks, a huge presumption. And so that can really stymie not just a project, but it could stymie a whole collaboration, because I've heard a colleague describe it as drive-by research. Where people feel like they've been, an act of social science has been committed on them, and that, that they're going to suffer the injury. So I think that we have to, think more about how the work really serves the interests of the data custodians, the people who manage these programs and these policies, as the priority. And if we can get academic research out of it and publishable findings, that's fantastic. That serves our purpose. But the chief motivation for doing the work should be improving the systems, the programs, the policies, serving the public ultimately, and they did not give their consent for these data to be used for just abstract research purposes. There's lots of legal justification for doing it for evaluation and program improvement and all these things. So those are like kind of legitimate, already, embedded in the law kind of uses of these data. So bringing in research has to be done delicately and in a way that respects, the purpose of the data and the context, the policy program context in which the work will be received.
Thanks. Those are very also profound and important words about our accountability for change, right? And I appreciate that very much. Did anybody else want to speak to any missteps that we should avoid, generalizable lessons? Sorry.
Yeah, I can mention one of the common mistakes, or if we look at the literature, when the social determinants of health started to gain traction, the first papers written by biomedical researchers were just used a single variable that was decontextualized, and on top of that was written for a medical journal that has a very tight word limit, so there is no space to elaborate on the context or implications. So that leads to misinterpretation or stigmatization, etc. All the perils that we are now well aware of. So I echo what Dennis said about that the scientific paper is not the only or the main product. It's just one component among all the different dissemination products. And it has to be kept in that space, right? So another thing is that even though we as researchers may have the willingness and and put the effort in doing the contextualization, we still need experts from the other fields, for example, education or justice, and the people involved in those systems as well, right, with lived experiences and those advocating for it, right? Because otherwise, our level of academic interdisciplinarity may be greater, but still not getting there.
The engagement of the people who are directly affected. Yeah. Thanks. Anyone else want to weigh in on that question? We have lots of questions now, actually.
Yeah, if I can just say, I mean, I think it's really helpful if you can create opportunities to give presentations, to talk, to to have Q&As, and because they won't come to our conferences. The people in government, they have limited time, so it's sort of formulating things that they can drop into. Anonymous Slido questions is always useful, so their bosses don't know who's asking the difficult questions. So those sorts of things, as well as very short summary documents for people with that don't have much time to read these in-depth papers.
Yeah, and building on that, there's a question. One of the questions in the chat is about other strategies for making sure that these agreements and partnerships are a little bit more reciprocal. So models of data access. So this is a little bit less around probably, but maybe not, the potentially the people who are directly affected, the citizens, versus the service providers and the policymakers. But any thoughts on models to help make the relationship a little bit more reciprocal, but direct data access, etc.?
Direct data access, do you mean, does this question mean to members of the public? Sorry, I'm not following that.
No, well, could be public or the data providers.
Yeah, I mean, we're working on a model where the academic team, so our team has done a lot of the curation of the data and sort of quality control, and is looking at new bits of data that come in. So we're doing a lot of that work, and that database is then used by government, so they don't have to redo all of that curation. So that's a huge amount of work that gets done with research funding. There's a big issue, I think, about the sustainability of that, pipeline, managing the pipeline and the continual curation, and decisions about what new data, because there's always new data becoming available from different government departments, what new data should be added in and at what cost to sort of time and curation. So that's something I think that the partnership helps. I don't think we've quite sorted it out. I don't think there's there's more room for understanding how much work there is involved in this data curation, with these sort of complex databases coming together. And I think that's still being learnt. Department for Education understand their data, but it's a whole nother problem when it's linked to all this complex health data and social care data. I think it's that needs more understanding and more support from the funder, for ongoing support from the funder to keep that curation going.
I think in terms of other little strategies or things that we found have been helpful, I like the idea, Ruth, you're kind of hinting at this idea of doing some of the work that they would need to get done, but you could actually do it maybe faster and better, pay for it in a different way. So looking at what stuff you can offer and looking at where the work gets done. So earlier on in our program, before the pandemic and before everyone used, Zoom and WebEx and whatever, we actually made our meetings in the government offices because it just saved a little bit of money and a little bit of maybe money, but I meant a little bit of time in terms of people being able to slip out from a meeting and show up for part of the meeting. So looking at where you have your discussions and looking at like how to frame the discussions, like how much time and how to introduce it and how to repeat things and knowing also in terms of who your partners are in government. Sometimes I think even when you're putting a grant together, you might try to have some funding for someone, whether they're in government, whether they have lived experience or they work in a provider agency tied to the construct you're studying. So you can look at funding to support them, but you also have to think about who's really the person that's very excited about that work, that's hopefully going to be able to continue to do the work. Because I think sometimes we think with grants, let's put down like the most important, best people to write a letter to say they can do this work with us, right? But you want to have a relationship with people who get it and who are, able to do exactly the kinds of things you want to be working on. So thinking about who you pick and also having multiple people connected to it, I think is another strategy. So having the funding for it, knowing where to meet and making sure you can adjust maybe the way you used to do your meetings to a way that fits better with the people you want to work with.
Thanks. That's all very helpful. We're almost out of time, but there was one question that I thought might be a good way to end, and we've heard some examples already. But the question is really about, given the time the partnerships take, and certainly I think we're hearing a lot about, the time it takes to do so much of the bridging of different worlds properly, the time it takes, the time and resources it takes to clean data and do all that. But one of the questions coming from someone in our data partnerships group is maybe just a reflection on some quick wins and just examples of really high impact work that helped create momentum for either a specific partnership or the whole concept of bringing data from different ministries, different sectors together.
Well, I'll just say, I think projects that are particularly good at distinguishing subgroups of clients within the different agencies that are really actionable, because you can say, oh, well, we're not just dealing with people with, special education needs, where we actually have these really distinct groups that have different trajectories. There's ways that the agencies can immediately respond to that in thinking about how they're aligning resources, because that's the big responsibility for these agencies, is typically how are they going to spend their money, how are they going to be most effective with that. So any information that you can give people to shed light on what previously was dark for them, and gives them an idea of more strategic thinking and working, I think that's a quick win.
Great.
And I think the equity argument is part of that, showing, for children with similar problems like Down syndrome or cerebral palsy, that if they're in one area of the country, they're much more likely to have special educational needs provision maybe a year or two earlier than in another place. That's showing variation between the local jurisdictions is really powerful, and then of course has to be dealt with sensitively, because it's really generating questions about why those differences might be, and what else might the ones that are offering services later be doing. But it's a very useful starting point for discussions about how different areas run their services.
So doing things at the level of that makes sense administratively.
Yeah,
for
exactly.
Accountability. Yeah,
Yes.
No, for
Yeah.
sure.
Yeah.
Yona, Marcello, any other examples?
I just think helping people appreciate how things can be done. So if you have an example, even if it's from another jurisdiction, to show like this is how it worked, and this is what difference it made, and these are the steps that are taken, so it doesn't feel quite as complicated.
Thanks. Marcello?
Yeah, well, something that I think has worked at the MCHP was um, when it was a negotiation about acquiring a new data set, bring the data providers and offer them to what research questions or questions are important for them, and along the data acquisition process and the data understanding by the center is this working together to answer those questions first, right? So that way you get the support and of the data providers themselves to help you understand their data, and so you are using it for the first time where they guidance as well. So that I think that has worked pretty well.
Thanks. That's very helpful as well. I'm sorry we weren't able to get to all the questions. Some of them are quite specific to what the ICS strategy is going to be around data partnerships. And I would say that we will, as we start to build this strategy, we will definitely share and consult with the ICS community and much more widely about that. So I would say stay tuned for that. And in the meantime, I really want to extend just a very warm thanks to our 4 panelists. There's so much to this whole topic. Many, I think, important lessons. We're lucky that we can draw on the experiences from other jurisdictions. We're lucky that we have good relationships with our with you as colleagues, and we certainly will be, drawing on that as we move forward. So, maybe I'll put a plug in for Dennis's meeting in Chicago in September, the International Population Data Linkage Network meeting, where I think there'll be, this is a topic, or many of the areas that we've discussed are often gone into depth. So we'll be looking forward to, continued discussions there and in other venues. So thank you. So thank you very much. And to everybody, there's a short break now, and then stay tuned for part 2 of this afternoon related to broader data and better health, the policy panel that Michael is chairing at 3:00. Thank you.
Thank you.